Hello friends, today we are going to discuss one very interesting case in ENT, and this radiograph as shown in the picture is of a 25-year-old girl which presented to our ENT OPD with a complaint of colicky pain preprandially and intermittent swelling of salivary gland. He came to us and told us there is pain as well as intermittent swelling of the salivary gland, and the pain is usually present preprandially. Since and we took the history, done a bimanual examination, and we found a hard swelling on the floor of the mouth on the left side. It was stony hard in consistency, and there was a slight swelling on left submandibular region, and the girl told us a peculiar history that the swelling increases upon when she has her meals, when she eats something. So these were the peculiar point about her history. So we went for the most basic investigation for our suspected case, and we go for we found that there was a homogeneous radio-opaque opacity on the floor of the mouth on the left side. Now I think you all can appreciate this. There is a homogeneous radio opacity in the floor of the mouth on the left side. Now the question arises is what is this homogeneous opacity can be, along with the history what I had provided you, that this diagram is of a 25-year-old girl with a history of acute colicky pain present preprandially, and there is intermittent swelling of salivary gland, or specifically or more layman language we will say the swelling in the submandibular area. As well as the girl told us a peculiar history that swelling increases when she takes any meal or when she eats something. So we went for investigation and we found a homogeneous radio opacity in the floor of the mouth on the left side, which is the same side where the girl told us about the pain as well as the swelling. Okay, so we had to identify this pathological condition, which has been marked by a red arrow. So coming on to the discussion of the case. So in our scenario, in our history what we have got and the examination we have done, the examination is done by manual palpation of the submandibular salivary gland, and we found a stony hard swelling on the left side on the floor of the mouth. So the diagnosis, most probable diagnosis for this goes to, that is Sialolithiasis, which is also known as salivary stone. The stone is in the salivary gland, and actually it is in the salivary gland duct. That's why it's known as Sialolithiasis. Most common gland which is involved is submandibular gland, and this is the duct of submandibular gland. See the variation. 80 to 90% of sialoliths are seen in the submandibular gland. This is very important question. Second, 6 to 20% are seen in the parotid gland. So second most common gland which is involved in the stone is parotid. So we have to remember this. Most common is submandibular, second most common is parotid, and only 1 to 2% cases this is sublingual and minor salivary gland. We can see this sialolithiasis. Okay. Coming on to why submandibular gland is more prone to the formation of stone, and what was the reason of intermittent swelling of the girl whenever she takes anything or whenever she eats anything. Second most doubt which is in everyone's mind, I think right now, is what was the reason of acute colicky pain preprandially. So we will discuss three questions separately. First of all, we will discuss what was the reason why the submandibular gland is this much involved in sialolithiasis. So mainly 4 reasons has been described in books. And the first of the reason says that is the duct of submandibular gland is Wharton's duct. So it has a tortuous course. The duct has a tortuous course. Number 1. Second, the secretion in the duct are usually high in calcium and magnesium. Okay, sorry, the calcium and phosphate, not magnesium. Second, third is the dependent position of submandibular salivary gland that leaves them prone to stasis. We know that the secretion of submandibular salivary gland is anti-gravity. So that's why the secretion is usually stasis in the duct. And fourth one is the increased mucoid nature of the secretion. So these all 4 features which are present in the submandibular salivary gland make it more prone for the submandibular, or we can say for sialolithiasis. What are those 4 causes? One is the tortuous course of Wharton duct. Second, higher calcium and phosphate level. Third is the dependent position of submandibular salivary gland leading to prone to stasis. And fourth is increased mucoid nature of the secretion. Now we leave with the 2 questions. What was the reason of colicky pain preprandially? So whenever we see any food in front of us, the secretions start in the salivary gland. We know that most of the saliva is secreted upon seeing as well as the smell of the food. So as soon as the salivary gland start producing this saliva, and the saliva start pushed on through the duct, that is the Wharton's duct. So as the secretion increases and Wharton ducts get dilated, it is a duct. So it will have this colicky pain that will be present preprandially. And second question was why there was an intermittent swelling of the salivary gland. So when she or he takes any meal, since the stone has completely or partially blocked the flow of saliva, so this is result into the salivary pooling within the gland ductal system. So due to the pooling of saliva in the gland ductal system, we will see a swelling in the area of this submandibular area. This swelling will spontaneously reduce slowly after few interval of few hours, and then again when she or he will have something to eat, the swelling will increase in size. This is the known as intermittent swelling of salivary gland. So today we had discussed about sialolithiasis. What is its common sites? What is the reason why they are most commonly found in the submandibular gland? what are its symptoms and signs. Thank you. Stay tuned for more such videos. Hope you like it. Kindly share and subscribe.